First of all, I love Dr. LORIA. I think that he's a phenomenal human being. Aside from being a great doctor and an artist, and you know, he cares about people. He cares about every single guy that comes through there. And you know, I mean, I'm just me, but I have spent some time with him, and I know how he treats every single guy. There's nothing special about me. I mean, just that I pay close attention to people, and I just think LORIA is a phenomenal guy. He cares about everybody. He pays attention to you. He's going to listen to you. He listens to your concerns. This is very unorthodox from the medical profession. Most doctors aren't too interested in hearing what the patient has to say. In this day and age that we live in, he does. You know, he does listen to you. He does care, and he not only that, when he does the procedure, it's a work of art for him. He cares about each time he goes in there to do the job. He wants to do the best job he can do for everybody. So I think there's just so much to be said about that, and I think that his follow-up from the procedure, his follow-up, first of all, is part of his procedure. That's a big part of his procedure, and whether it's him doing it or the people that he's trained, he teaches that as part of the you know, curriculum. You know, if you're going to do this, you got to continue the follow-up. You have to send the pictures. You have to stay in contact for the couple of weeks or a month or whatever it takes to stay in contact till you're on your own. I said to the doctor, I want to be 7.5, and we're talking about girth here, right? But I want to be 7.5 by, you know, whatever length, doesn't matter, you know. And he tells me right away, he's like, no, you don't. You don't want to be 7.5. And I'm like, why not? Sounds good to me. And, you know, but he didn't let me just run with that. He's like, look, you're a married guy, you know, 7.5 is too big. Women can't fit that. And I'm like, okay, you know. That's knowledge, you know. You know. So he counseled me through that, and he's like, listen, this is where you want to be, somewhere in the 6.5, whatever. You know, he's telling me it's too much, you know, and I was like, okay, great, and I'm thankful that he didn't just say it's not because he couldn't, right? I mean, he has the technology, he has the ability to just go do whatever people ask for, but he cares about the people enough to say, wait a minute, no. That's not what you need. It's not what you don't want to do that, and for all the right reasons, you know. Now, maybe if I was a single guy, he may have had a different conversation. I don't know, but he knew enough in asking me questions and getting to know me in just a few minutes' time to know that it would be the wrong thing to do. And I'm so thankful, because if I had gone that far, you know, I asked a lot of questions, and I did ask a lot of questions as I was evaluating this process, and but Dr. LORIA was just he's very good at being able to just to answer the questions and tell me exactly what the process was. He has it documented, and I know he was always making changes to it to make it better. He's always looking to make it better. And having known Dr. LORIA now for a couple of years, I've watched him continually improve his processes. So, you know, he cares about the people. He cares about what he's doing, and he wants to make it the best that he can every time he does it. During the actual process, the procedure itself, he's awake, you're awake, you know, you're there, he's talking with you, he's having conversations with you, not so much about, you know, I'm going to do this or I'm going to do that. I don't think that's so important, but he is asking about pain. He definitely does not like anybody to feel pain, so he's going to ask you the questions. You know, he wants to give you a 1 to 10, how you are on pain, and if he hears a 2 or 3, he does something to, you know, alleviate that pain.